When diagnosed with cancer, there are a lot of unknowns, and our patients are wrapping their brains around language they've never heard before: PET scans, regimens, tumor staging, and trying to become an overnight expert of what all of that actually means. Thankfully, one thing a patient doesn't have to worry about or become an expert in is how to protect and prepare their bodies for treatment and recovery, because that is exactly what a cancer rehab physical therapist does. A physical therapist works with people during all stages of treatment as their recovery coach. I help prepare people physically for cancer treatment with strategies, exercises, and expectations so that they can feel more in control. I work with patients during treatment to help expediently address side effects and minimize any discomfort. I work with patients after treatment who haven't returned to their prior level of function.
OT, or occupational therapy as a whole, focuses on the occupations we do during our day. So either getting dressed, cooking, taking care of grandchildren, hanging out with family. So as a cancer rehab OT, I have to identify what patients really like to do and how they need to spend their time. And then I get to enable them to do that occupation. Some kind of this fun cross between a physical therapist and a speech language pathologist, because I can use physical interventions, so exercise, range of motion, strengthening, things like that enable somebody to move better during their daily occupations. But I can also do cognitive work as well. We can modify and adapt tasks. So how do we give you little cheats and tricks to make things easier, as well as still skill building. So eventually you won't need those kinds of cheats and tricks anymore.
Hi, my name is Erin, and I'm an outpatient speech therapist. I have the pleasure of working extensively with patients with various types of cancer. And as a speech therapist, one of the things that I get to do is help them improve some of the most fundamental human needs, which is their communication and their swallowing function. Cancers of the brain can often result in difficulty of someone understanding what other people are saying, as well as difficulty making their own wants and needs known. Speech therapists can work with these individuals to help them improve their functional communication and increase their independence and their ability to participate in social interactions. The other major area that speech therapy can help to address is swallowing function. This is something that can be the result of various types of cancer, including brain cancers and head and neck cancers. We as speech therapists can help them improve not only their nutritional and health status, but also improve their quality of life by their ability to participate in meal times with family and friends.